Importance of oral health care. The relevance of oral health to overall well-being cannot be overstated. It describes the state of the gums, teeth, and complete oral cavity. The following are some major justifications for why maintaining good oral health is important. Maintaining dental health. Maintaining healthy teeth and gums requires good oral health. Tooth decay, gum disease, and other oral infections can be avoided by regular brushing, flossing, and dental checkups. Extensive dental procedures like fillings, root canals, and extractions can be avoided with good oral hygiene practices. Overall physical health. Oral health and general physical health are intimately related. Numerous systemic illnesses, such as cardiovascular disease, diabetes, respiratory infections, and unfavorable pregnancy outcomes, have been linked to poor dental health. Neglecting oral health can make these disorders more likely to occur and make them worse. Dental disease prevention involves maintaining good oral hygiene habits and visiting the dentist regularly. Regular dental checkups can effectively prevent or diagnose mouth infections, gum disease, and tooth decay. Oral diseases can be stopped in their tracks and their negative effects on oral health can be reduced with early detection and treatment. Better nutrition and digestion. Proper chewing and digestion of meals depend on good oral health. Dental issues, such as tooth loss or malocclusion, can make it difficult to chew food properly, which can compromise digestion and nutritional absorption. Proper nutrition and general well-being are supported by maintaining healthy teeth and gums. A person's appearance and sense of self-worth are greatly influenced by their oral health. A beautiful smile and healthy teeth can improve social relationships and raise self-esteem. On the other side, problems with the mouth, such as tooth loss, discoloration, or foul breath, can have a negative psychological impact and lower someone's quality of life. Speaking clearly and communicating effectively both depend on good oral health. Speech clarity can be hampered by dental issues like missing teeth or malocclusion, which can impact how some sounds are pronounced. People who practice proper dental hygiene are able to speak more clearly and confidently. Early detection of systemic conditions. A number of systemic conditions, such as diabetes, HIV, AIDS, and some types of cancer, can show signs in the oral cavity. Regular dental exams enable the early identification of such symptoms, enabling prompt referral for additional medical assessment and treatment. Long-term cost savings. Investing in dental care routinely and through preventative measures can result in long-term cost savings. Early intervention for oral health concerns and the prevention of dental diseases is typically less expensive than costly procedures or operations for treating more severe dental difficulties. In conclusion, keeping good dental health is crucial for general health and well-being. People can enjoy the advantages of a healthy smile and lower their risk of oral and systemic health issues by maintaining good oral hygiene practices, seeing a dentist regularly, and taking care of oral health issues as soon as they arise.